3, 4 and 5, we continue the care of scenario 2, whereas Anthony DeBuzzy, that has just arrived in the emergency department, to Anthony now being in the emergency department for about an hour and requiring intubation. Then in the intensive care, where paralysis and sedation seem to be things that might be considered appropriate care. And then scenario 5, where we go through the actual act of proning with SimAN 3G.
So we have a few objectives here today. Our first objective is to explore the support materials for the Ingmar SimAN 3G immersive simulation scenario, which Liz already touched on. The second objective is to demonstrate operations of LEAP scenario file in support of peer-reviewed literature. And the third objective is to the demonstration of all 3 scenarios within LEAP, the Ingmar plugin and the ventilator, which you'll see here in a few moments.
So before we jump into the scenario, I would like to quickly introduce the technology that we used to run it. And what you see on the screen right now is the ASL5000 lung solution. And this solution integrates the world's most realistic breathing simulator, the ASL5000, with the SimAN 3G, SimAN Essential, and the new SimBaby to run scenarios with a spontaneously breathing patient supported on a ventilator. In today's scenario, we use a SimAN 3G. And a fun fact about the ASL5000 breathing simulator, there are over 1,000 ASLs in the world out there being used for educational training and research and development. So how does this all come together and work? You'll see the ASL5000 breathing simulator sitting to the patient's left. And that is what is creating our patient's respiratory mechanics based on our instruction from the LEAP software. The patient's spontaneous breaths are routed through the circuit coming from the ASL5000, through the mannequin, and out of the mannequin's mouth. Now, the ASL5000 is producing not only inhaled tidal volumes, but exhaled tidal volumes as well. So if you were to simulate a spontaneously breathing patient in LEAP and you place your hand over the mannequin's mouth, you will feel that exhaled tidal volume. Then when we actually intubate our patient, as you see in this picture here, we have him on a real ventilator, and that ventilator is delivering support through the patient circuit, through the mannequin, through that other patient circuit, leaving the mannequin, and to the ASL5000. And it's very important to note that the airflow is bidirectional between our patient, the ASL5000, and the ventilator. So in the end, we now have a high-fidelity mannequin simulator, which can be intubated and placed on any real ventilator, which gives you realistic hands-on training scenarios. You as the instructor will control the patient via the LEAP software, and your learners will reference exactly what they see here and what they would be seeing in real life, their patient, a patient monitor, and a real ventilator. Okay, let's get into the scenario.
Thanks, Liz. Just before we start into the scenario, it's worth noting that we have uploaded scenario information in a Word document to Scenario Cloud. Scenario Cloud is pictured on the right-hand side. The reason why we've made it as a Word document is so that you can change it or you can alter it to suit your local clinical practice guidelines. Hopefully the scenario meets your needs, but you may need local tweaks based on local guidelines. In the scenario files on Scenario Cloud, we also have support information such as blood gas analysis and chest x-rays. This chest x-ray is associated with the third case for today's series. Let's get into the scenarios now. The first scenario, scenario 1 in the emergency department, is a scenario that commences in the emergency department 1 hour after the patient's arrival. Just pausing here at the moment to show you that the scenarios are made to work in automatic mode. The reason we've chosen to use automatic mode is so that more operators will be able to utilise the scenario. It doesn't require someone to, on the fly, make multiple changes, both on the ASL and on the hemodynamics, to make a realistic scenario. These scenarios are completely unlocked. So if at any stage there's things that don't feel right or things that you would like to change to suit your local practice, that is totally okay. We've set them up in a scenario file that is unlocked for you to make further changes later. Okay, let's keep going. When you download them from Escenario Cloud, you can attach them to your desktop, you can browse and then select the file. We're currently up to a version 9 of these files, as we're currently getting some feedback, and version 9 seems to be going quite well. This is now the scenario outline. I'll just give you a bit of an overview of the scenario outline. So the scenario outline is for the instructors, and as you can see, the scenario presents with a 71-year-old male suspected of COVID-19, already admitted to the emergency department. The patient was admitted over an hour ago and is waiting for an intensive care bed. The participants are expected to assess and recognise deterioration in the patient's respiratory condition and should appropriately increase ventilatory support while maintaining appropriate respiratory precautions. We have written a learner brief there as a guide. You may want to change this if it doesn't suit your local area. The emergency room, it's at 10 o'clock in the morning. Your patient is Anthony DeBuzzy. He's a 71-year-old male presented to the emergency department 1 hour ago. Background, the patient has non-insulin requiring diabetes and chronic kidney disease. The patient reported fever, dry cough, chest pain and respiratory difficulty. The patient has been swabbed for COVID-19 and is in an isolation precaution room. ICU does not have a bed at this stage. The patient's respiratory rate appears to be increasing despite the oxygen. When he arrives at the emergency department, his oxygen saturations were only 91% on room air. He started on nasal cannula, but currently he's on 8 litres via Hudson mask and his saturations are only 94%. Patient has recently deteriorated and has now got increasing shortness of breath. Recommendations: please assess the patient and provide respiratory support as needed. There's a list of learning objectives, such as perform primary assessment of patient with a severe acute respiratory infection. Potentially change to non-invasive support to maximise patient effort, if that's one of your local guidelines. Express the need for intubation of the patient to stabilise respirations. Perform the intubation of the patient in a timely manner. Connect the patient to a ventilator and contact the intensive care unit to discuss ongoing care. And then doffing, obviously, of the PPE equipment. As we move through, we also have things such as the equipment list. You will notice in the equipment list we have certain medications that may not be appropriate at this point in time, such as albuterol or salbuterol listed in the medication list. The reason why we have included it in the medication list is so that when you are doing simulation, people may choose to aerosol a medication, and this may be an important debriefing at the end of the scenario. We've tried to keep the equipment list fairly similar throughout the cases. Most cases will require medication. Most cases will also require some sort of airway devices. We have included on the list non-invasive ventilator and a ventilator for this scenario. This scenario is designed to work with SimBand 3G, SimBand 3G Mystic, SimBand 3G Trauma, Essential and Bleeding. So let's just pause here just to familiarise yourself with the layout. You will notice that we have laid out the entire graphic user interface in a specific way. The reason why we've laid it out in this way is to make use of the things that are going to be utilised in the scenario. You'll notice in the top left-hand corner are the events that we'll click through in the scenario. The middle section is dedicated to the INGMAR plugin and the ASL controls, and then on the right is the hemodynamic information as required. Jess, did you want to walk through some of the lung model?
Yeah, thanks, Amy. So in these scenarios, we have built custom lung models to make it as simple as possible for you to run through. So you can see here to import them, you just click on the import button and pick the associated lung models. Then you're going to choose all of the models and import them just by clicking that arrow there. Once they are imported, you will see them listed in your custom model library. And when you are prompted during the scenario, you'll just simply click on the appropriate model and apply it without having to change anything. So it's just simply click on the appropriate lung model and all of the lung mechanics are working in the background for you, and you don't have to manage that during the actual simulation portion. Once you start running these, you will see the ASL monitor in the middle. This should give you a general idea of flows, pressures, and volumes from both the patient and the ventilator. All right, so then we're ready to connect and play the scenario. All right, back to you, Amy.
Thanks. So we've designed it with some pop-up messages like ensure the ASL is connected and choose the non-invasive support so people don't need to remember. On the left-hand side of the screen, we'll just pause there for a second. We have different types of events. These are wash hands, apply the long sleeve gland, apply the N95 mask, perform the seal check, apply face shield and apply gloves. We ideally would like people to obviously practice what they would do in clinical environments, so applying the PPE would be appropriate. However, some places have different guidelines and requirements, so we suggest you follow your local guidelines. If you do not want to utilise the donning of the PPE in the scenario, that is totally fine. You can click on Move to Patient Encounter if that's what you clinically decide at your facility. Okay. As you do select them in the debrief log, they are in sequential order. So if they are done in a different order, that will also come up. Let's move to the patient encounter. Once again, a reminder just to make sure that we have the right non-invasive support lung model playing. At the very start of the case, we've got some things on arrival: introduce self, assess level of consciousness, assess breathing and assess pain, as the patient did report chest pain prior to starting the scenario. We then go on to a primary assessment. You'll notice these have zeros next to them, and that's because we think it might happen more than once in the scenario, and we'd like to count to see how many times reassessment of the patient occurs. So as you tick them off, you will see a number 1 appear next to the event, and they won't disappear. Assess circulation, we think will disappear to make it easy. If you click the Analyze X-ray, you will actually get an X-ray appear on the chest X-ray on the patient monitor. Just pause there for a moment. We have 2 initial treatments built into the scenario. One is apply high flow nasal oxygen, if that's something that is done in your facility. The other is commence non-invasive ventilation. And as Liz explained earlier, when you apply the non-invasive ventilation to the face of SIMAN 3G, it does actually respond. The only thing you can't use with SIMAN 3G is a full face non-invasive mask. You can just use more of a mask type rather than the full face shield. So as you click off either of these items, you will see a slight improvement in the patient condition. However, the patient will not get to a stage where they don't need intubation. So in today's case, we'll just click the non-invasive just to show you there is a slight change to the hemodynamics. Communication is always an important factor in simulation, so we have added some communication elements to each one of the scenarios, such as decision to intubate and inform the patient. When we move to the intubation page, we have on the left-hand side of the screen all the medication, and on the right-hand side of the screen all of the correct treatment for the intubation. We just pause there for a second. You'll notice that all of those medications have actual events listed in behind the scenes so that we can actually see a response. If these aren't the medication that you use in your clinical area, you can change these in the scenario later. Each one of those medications have a desired effect, and once the patient is sedated and ready for intubation, then we can move on to a different type of lung model. On the right-hand side, you will see two options, hyperventilation and non-rebreather. Depending on your clinical environment, you may choose to hyperventilate or you may choose just non-rebreather hyperoxygenation. Both events work depending on how you go through the scenario. Okay, let's see how it plays out. For today's example, let's give propofol. If we gave 20 milligrams of propofol, it has a different response to giving 100 milligrams of propofol. As you notice, you will see that the eyes have closed and the patient has stopped breathing. We can attach the non-rebreather and hyperoxygenate, apply cricoid pressure, insert the advanced airway. As we click off the first ventilation, in the debrief log, it tells us how many seconds it took to get the tube down. Once we've confirmed the tube placement, we have some settings there. I'll pause there for just to...
Yeah, so you can see here we have our initial vent settings. We are in volume control with a set rate of 20 to try to get that CO2 down. We are also targeting a volume of 420 for our patient to maintain the 6 mLs per kg of ideal body weight for this patient. His ideal body weight is 70 kilos. And the flow should be set to around 65 liters per minute. Just keep in mind if you're using different ventilators, that flow can vary between vents.
As you can see here, then there's still some actions to be done, such as securing the tube and attaching the ventilator. But
So this is the vent screen. You can see here, if we just pause for a second, that the patient is only receiving controlled breaths due to the sedation and paralytics. If you look in the left-hand corner, there's a C, meaning that the breath is controlled by the ventilator, and you see the total rate matches the set rate for the patient. Now, keep in mind, we are showing 21% here of oxygen due to the fact that we just did not have access to real oxygen at the time.
thanks, Jess. And let's now look at the patient monitor. It's interesting or worthwhile noting that on the patient monitor, as the patient is now starting to get some breaths from being ventilated, airway respiratory rate will increase. The airway respiratory rate that is displayed on the patient monitor is that of both ventilated breaths and spontaneous breaths. This is different to what we see on the instructor PC. On the instructor PC in the top right-hand corner, the airway respiratory rate reads 0, and that's because the breaths that are coming onto the patient monitor are all ventilated now. Okay, so we've inserted the tube and you will see some changes to the hemodynamics. We then have some options for after the procedure. They could also at this point in time do another reassessment of the patient, make sure that they're okay. There is doffing options in the scenario, such as ensuring safe removal of the PPE, and then obviously we can end the scenario. This is really where you, the experts, come in. Watching the debrief experience and seeing what happened in the scenario will help you guide to different ways of running the debrief. In the support material, we have listed a number of GAS questions if you need a bit of help with summarising and putting together and formulating your debrief. In the session viewer files, you will see the learner brief and the learning objectives listed as a reminder when we're starting the debrief. In these scenarios, we have also built a performance tab. The performance tab can have your hospital logo added to them, and what the performance tab allows you to do is to tick through a checklist of desired effects. As said earlier, you can update this or change this if these desired effects are different for your facility. You can also print these out as proof of the training that you've been doing to prepare for the COVID-19 outbreak in your facilities. Let's move on to case number 2.